5 common types of toothaches. There are several types of toothaches and we are going to talk about 5 common types of them. Number 1, pulpitis. Number 2, periapical abscess. Number 3, gum or periodontal abscess. Number 4, referred pain. And number 5, dental trauma. Pulpitis. This is inflammation of the dental pulp, which is the tissue inside the tooth that contains nerves and blood vessels. Pulpitis can be caused by tooth decay, trauma, or gum disease. There are 2 main types of pulpitis: reversible pulpitis and irreversible pulpitis. Reversible pulpitis. This is a type of pulpitis that is characterized by inflammation of the dental pulp, but the pulp is still viable, alive. Reversible pulpitis can often be treated with a deep cleaning or a filling, and the tooth can be saved. Irreversible pulpitis. This is a type of pulpitis that is characterized by inflammation of the dental pulp that has progressed to the point where the pulp is no longer viable, is dead. Irreversible pulpitis often requires a root canal procedure to remove the infected tissue and save the tooth. If left untreated, an abscess, a pocket of infected pus, may form at the tip of the root of the tooth. Periapical abscess. Periapical abscess is a type of dental abscess that affects the tip of the tooth root. It is caused by an infection that has spread from inside the tooth to the bone surrounding the root. Symptoms of periapical abscess may include tooth pain, especially when biting or when pressure is applied to the tooth, sensitivity to hot or cold temperatures, swelling of the gums near the affected tooth, and fever. Periapical abscesses can be treated with a root canal procedure, in which the infected tissue inside the tooth is removed and the inside of the tooth is cleaned and sealed. The abscess may need to be drained surgically. It's important to treat a periapical abscess promptly to prevent the spread of infection and to save the affected tooth. In some cases, the tooth may need to be extracted if it cannot be saved. Gum abscess, also known as a periodontal abscess, is a pocket of pus that forms in the gums due to an infection. It's usually caused by bacteria that build up in the mouth, often due to poor oral hygiene. Common symptoms of gum abscess include pain, swelling, and redness in the gums, a bad taste in the mouth, and difficulty swallowing or speaking. The abscess can also cause fever and general feeling of ill health. Treatment for a gum abscess usually involves draining the abscess to remove the pus and bacteria. This can be done by making a small incision in the abscess or by using a needle to puncture the abscess and allow the pus to drain out. The affected area will then be cleaned and a course of antibiotic may be prescribed to help clear the infection. In some cases, the abscess may be so severe that more extensive treatment, such as surgery, is required. Good oral hygiene is the best way to prevent gum abscesses. This includes brushing and flossing regularly, using mouthwash, and getting regular dental checkups. Referred pain. Referred tooth pain is pain that is felt in a part of the body other than the tooth itself. This can happen when pain signals from an irritated or damaged nerve in the tooth are misinterpreted by the brain as coming from a different area of the body. Referred tooth pain is often felt in the head, neck, or ear due to the close proximity of the nerves that supply these areas to the nerves that supply the teeth. There are many potential causes of referred tooth pain, including tooth decay, a cracked or broken tooth, gum disease, and abscesses. In some cases, the cause of referred pain may not be immediately apparent, and further evaluation may be necessary to determine the cause and appropriate treatment. Dental trauma. Dental trauma refers to any injury to the teeth or surrounding tissues of the mouth. Dental trauma can range in severity from a minor chip on a tooth to a severe injury that results in the loss of a tooth. Common causes of dental trauma include falls, sports injuries, car accidents, and physical assaults. Symptoms of dental trauma can vary depending on the severity of the injury. Some common symptoms include pain, swelling, and bleeding in the mouth, as well as tooth sensitivity or mobility. Treatment for dental trauma may include medications to reduce pain and inflammation, as well as procedures to repair or replace damaged teeth. In some cases, dental trauma may require specialized care, such as endodontic treatment, root canal therapy, or oral surgery.